Hello and welcome to Pregnancy Info. Today we will discuss about the high rate of C-section deliveries. One of the first major decisions you will make as a mom-to-be is how to deliver your baby. While a vaginal delivery is considered safest, doctors today are performing cesarean deliveries more often. A cesarean delivery, also called a C-section, is a common but complicated procedure that poses health risks of mom and baby. Here we will tell you what is C-section delivery. A C-section is a surgery in which your baby is born through a cut that your doctor makes in your belly and uterus. It is a kind of surgery in which your baby is born through a cut that your doctor makes in your belly and uterus. A C-section may be needed to protect the health of your and your baby. In these cases, a C-section may be safer than vaginal birth. Here are some reasons or causes that why C-section is doing so often today. What are the medical reasons for a C-section? A C-section delivery might be scheduled by your doctor in advance of your due date, or it may become necessary during labor because of the emergency. Here are some of the most common medical reasons for a cesarean delivery. Prolonged labor. Prolonged labor, also called failure to progress or stalled labor, is the reason of nearly one-third of cesareans according to the Center for Disease Control and Prevention. It happens when a new mom is in labor for 20 hours or more, or 14 hours or more for moms who have given birth before. Babies that are too large for the birth canal, slow cervical thinning, and carrying multiple can also prolong labor. In these cases, doctors consider a cesarean to avoid complications. Abnormal positioning. In order to have a successful vaginal birth, babies should be positioned head first near the birth canal. But babies sometimes flip the script. They can position their feet or butt towards the canal, known as a bridge position, or position their shoulder or side first, known as a transverse birth. Birth defects. To reduce delivery complications, doctor will choose to deliver babies diagnosed with certain birth defects like excess fluid in the brain or congenital heart diseases through a cesarean to reduce delivery complications. Repeat cesarean. About 90% of women who have had a cesarean can deliver vaginally for their next birth according to the American Pregnancy Association. This is known as a vaginal birth after cesarean or VBAC. Moms-to-be should talk with their physician to decide whether a VBAC or repeat cesarean is the best and safest option. Chronic health conditions. Women may deliver via cesarean if they live with certain chronic health conditions like heart diseases, kidney diseases. Vaginal delivery with this condition may be dangerous for mom. Cephalopelvic disproportion or CPD. A CPD is when a mom-to-be's pelvis is too small to deliver the baby vaginal, or if the baby's head is too large for the birth canal. In either case, the baby can't pass through the vagina safely. Cord prolapse. When the umbilical cord slips through the cervix before the baby is born, it is called a cord prolapse. This can lessen blood flow to the baby, putting the baby's health at risk. While rare, a cord prolapse is a serious condition that requires an emergency cesarean delivery. Doctor will also suggest a cesarean if the mom-to-be has HIV, genital herpes, or any other infection that could be transferred to the baby through vaginal delivery. Placenta issues. Doctor will perform a cesarean with the low-lying placenta partially or completely covers the cervix. A cesarean is also necessary when the placenta separates from the uterine lining, causing the baby to lose oxygen. According to the American Pregnancy Association, placenta previa happens to 1 in every 200 pregnant women. About 1% of pregnant women experience placental abruption. Carrying multiples. Carrying multiples can pose different risks during pregnancy. It can cause prolonged labor, which can put mom in distress. One or more babies may also be an abnormal position. Either way, a cesarean is often the safest route for delivery. Another reason is that if your labor doesn't progress, this means it's too slow or stopped. Placental abruption. This is the separation of the placenta from the uterine lining that usually occurs in the third trimester. Approximately 1% of pregnant women will experience placental abruption. The mother will experience bleeding from the site of the separation and pain in the uterus. The separation can interfere with oxygen getting to the baby, and depending on the severity, an emergency cesarean may be performed. Uterine rupture. In approximately 1 in every 1500 births, the uterus tears during pregnancy or labor. This can lead to hemorrhaging in the matter and interfere with the baby's oxygen supply. This is a reason for immediate cesarean. Diabetes. If you develop gestational diabetes during your pregnancy or you are diabetic, you may have a large baby or other complications. This increases your chance of having a cesarean. Preeclampsia. Preeclampsia is a condition involving high blood pressure during pregnancy. This condition could prevent the placenta from getting the proper amount of blood needed and decrease oxygen flow to the baby. Delivery is sometimes recommended as a treatment for the condition. Only with severe preeclampsia is cesarean needed. The mother has a uterine condition or a fibroid obstructing the cervix is also a cause of cesarean. A fear of pain during childbirth or anxiety about vaginal delivery can also lead to a C-section delivery. A range of social influences including the media, friends and family, and also the today modern fashion to have no pain delivery or painless delivery. Narrow pelvic bone. If the mother has a narrow pelvic bone, then it cannot be opened fully to deliver a baby, so it is also a cause of cesarean delivery. Short-heighted mom. If the height of mom is too much small or she is dwarf, then it can also be the cause of cesarean delivery. If baby is too much weak or it is not tolerating labor pain or he is not responding to perform the process of labor, then it can also lead to a cesarean delivery. Sudden trauma or accident may lead to the stop of movement of your baby, so it can be essential for you to do cesarean delivery because of no movement or for the health of your baby. If mother is too much young, then she cannot bear the pain of labor, or if the mother is too much overage or with some diseases like diabetes, etc., both are not able to deliver normal birth, so cesarean is also done in these cases. If you have lost a baby in the past, either before or during labor, is also the cause of cesarean delivery. You have heavy bleeding during labor. If this happens, then doctor will do C-section to prevent the extra bleeding to save your life. Less amniotic fluid is also a cause of cesarean delivery because there are less nutrients and oxygen available in the amniotic sac. So, to save the baby, C-section has to be done. Now we will discuss the percentage of C-section. Only around 2.5% of C-section occurs at the mother's request without addressing a medical problem. However, this number has increased over the last decades. Another main reason or the cause of C-section delivery is that a doctor and an economist, not that doctor, are generally paid quite a bit more for a C-section, or they have had a commission in anesthesia and other epidural and drugs used in the C-section delivery, and even in each case they have the commission. So it is the reason of too much cesarean cases nowadays. Hope I have discussed all about C-section delivery and why its rate is too much high nowadays. If you like the video, share it, like it, and also subscribe my channel. And if you want to give me any suggestion, then comment in the comment box. Thank you.